Hi, I'm Dr. Michael Gartner, double-board certified plastic surgeon. Today we're going to talk about what you need to know the day of your surgery. So we're going to get into it in 2 minutes, so stay tuned. Dr. Michael Gartner, double-board certified plastic. A lot of questions about what to expect the day of your surgery, how to prepare. So I always tell my patients the week before that you have to stay away from supplements, anything that's going to increase bleeding. You want to stay away from Motrin. The only thing safe to take is Tylenol. The night before, you can't eat or drink anything if it's under anesthesia. We're mostly going to discuss anesthesia today. I do awake breast augmentation under local anesthesia. We're going to discuss that in another video. But how to prepare for an anesthesia case if you're having your surgery under anesthesia. You can't eat or drink anything the night before, so eat well and drink well. I also tell patients who work out a lot, do not do a killer workout the day before, because most doctors don't want you to work out weeks afterwards. You can fill your body up with inflammation, and you can be very inflamed the day of surgery. Have your killer workout 3 or 4 days before, okay, and then stop. We don't want any heavy nail polish on all the fingernails. We need one fingernail that's clear because we put a little device called a pulse oximeter which measures your blood pressure. So I need one fingernail that has like clear polish on it. Also the night before, you can shower. We recommend using antibacterial soap, and then no creams or lotions on the breast. Sometimes when we put a disinfectant on the breast, it kind of bubbles, meaning whatever cream and lotion you're putting on the skin is blocking the skin and blocking the disinfectant from taking effect, okay? Also, when you arrive, I recommend you wear like loose clothing, something that's going to button in the front, because you may have difficulty or soreness lifting up your arms after the procedure. On average, in my case, the procedure in the room usually takes less than an hour under anesthesia. Afterwards, we monitor you, and then we send you home to make sure everything's okay. So on a scale from 1 to 10, 10 being the worst, 1 being the easiest, most of my patients are around a 4, and that's also because I inject a lot of long-term local in the breast afterwards. Putting the implants underneath the muscle, which has a tremendous amount of benefits. We'll go over that in another video. But you feel a lot of pressure, which translates into pain once all that local medication wears off. And some patients have it worse than a 4, some have it easier, but those who have it worse complain they have a dump truck parked in their chest, they feel a lot of pressure. It's that pressure which translates into pain. But everybody says that 2 days later, it always takes 3 days for the body to relax. The worst is the first 2 days. The 3rd day always gets better. You'll feel a little bit more comfortable propped up on a pillow or two. When you're flatter, you're going to feel more pressure. Okay? So those are a lot of the issues, most common issues my patients asked me to explain on what happens the day of the surgery and a little bit afterwards. If you like this video, stay tuned. Give us some suggestions below in the chat box. And we hope you subscribe, and we're going to put on a lot more of these and talk to you soon.